I've always regarded rehabilitation medicine as the best of all worlds. So you have got the long-term relationship with your patient and with families, but you also have got the excitement of doing interventions and getting involved in the hyperacute and the acute management of patients.
What appealed to me most about rehabilitation medicine is the fact that it's a holistic specialty with a focus on the whole person rather than on a specific disease process.
The other thing about rehabilitation medicine is that it's a team sport. You're not an individual single practitioner, you're actually working with a group of highly skilled, experienced practitioners.
A big part of the role is helping patients and their loved ones to adjust to their new reality after what always tends to be a life-altering situation, a new reality after a trauma or an illness.
When you think that most of our patients are younger people of working age, you're working with not just the individual but their extended family. So you want to work very hard with the team to get that individual back, contributing to family life and society in the way that they contributed before.
One dimension is the acute consultation side. The second domain is the inpatient rehabilitation, where we supervise and coordinate the inpatient rehab program for our patients. So we work as part of a multidisciplinary team. So we lead and coordinate the efforts of our team in delivering the best possible care for our patients and helping them to achieve the best possible rehab outcome.
A lot of our approaches in terms of what we do around goal setting, etc., there are similarities, but it's quite different because the needs of our patient cohort are quite different to older patients. And that said, we also have the opportunity of working with children. So myself and colleagues would do quite a bit of liaison work with colleagues in paediatric services as well as older age. So for example, from a spasticity management point of view, I would be seeing a number of older patients that have got very complex disability that would be outside the scope and the experience and expertise of my geriatric colleagues.
I think helping patients along that journey, for me as a rehab physician, is a privilege.
There are a lot of big policy and strategic opportunities within Ireland that are going to be a game changer from a rehabilitation medicine point of view. So with the developments from a hyperacute management of stroke point of view, from a trauma strategy point of view, there is going to be a need for a lot more rehabilitation medicine consultants. So unlike a lot of specialties where career opportunities aren't very apparent, rehabilitation medicine is going to be one of the big areas for expansion over the next number of years.